let's see an NCLEX RN video based on cancer care. Cancer may metastasize through which systems? Select all that apply. Nervous system, lymphatic system, venous system, urinary system. The answer is lymphatic system and venous system. So here you need to understand cancer cells metastasize via lymphatic system and venous system, and the third one is cell to cell. That is, venous system is also known as hematogenous spread, and cell to cell, that is proximal cell growth. From one cell which is next to the other, the cancer will be spreading. What characterizes cells of a malignant tumor? Controlled cell death, well differentiated structures and functions, ability to proliferate rapidly, and contact inhibition. So here you need to understand certain features of malignant tumor and also of what a normal cell does. Cancer is characterized by two hallmark characteristics basically. They are uncontrolled cell growth and second is altered cell differentiation. So here the ability to proliferate rapidly is a characteristic feature of malignant tumors. We need to talk about some other points also in the slide. You need to know that the normal cells, they grow in a structured pattern, and this cell growth will be equal to the number of cells which are dying or shedding. And second point is known as contact inhibition. Normal cells are regulated by contact inhibition. That means they stop growing and reproducing, they come in contact with the other cells. But cancer cells lack contact inhibition. That means this malignant cells lack contact inhibition. So that option D is wrong. Then another feature is apoptosis. A regular cell or a normal cell, that cycle will end with programmed cell death. That means apoptosis is common with all normal cells. The cancer cells, they do not undergo apoptosis. That means they are not going to die in a programmed way. Then the third feature is anchorage dependence. So here the normal cells typically need to anchor to either neighboring cells or to the basement cells so that they can plug into a nutrient-rich extracellular matrix. Then only they will remain viable. But cancer cells, they don't need this type of anchorage dependence. That means they can grow and flourish in atypical patterns and any environment. And this uncontrolled growth of cancer cell is termed as dysplasia. That means the cell growth, their size, their shape, their organization, everything will be different. That term is known as dysplasia. Another thing you need to know about is neoplasm. The cell growth pattern in cancer, that is known as neoplasm. Here that means it is uncontrolled cell proliferation that happens with malignant tumors. Neoplasm happens with malignant tumors. Next term is anaplasia. When you see about the cell differentiation, you know that like the features of a parent cell, the daughter cells will be having. But when a cell loses its expected structure and function, it is known as anaplasia. Cancer cell proliferation progresses, they may not be similar to the parent cell, that is anaplasia happen. So here the only characteristic of a malignant cell is the ability to proliferate rapidly. They don't have a controlled cell death, they don't have well differentiated structures and function, and they don't have contact inhibition. Next question. What is the difference between the cells of a benign tumor and cells of a malignant tumor? Options. Cells of benign tumor are typically aplastic. Cells of malignant tumor are apoptotic. Cells of malignant tumors lack contact inhibition, and cells of benign tumors are characterized by uncontrolled cell growth. Benign tumor is something similar to the normal cells. So here the last point, if you are seeing, the cells of benign tumor are characterized by uncontrolled cell growth. That is wrong. They are having controlled cell growth. If it is benign, they are having controlled cell growth. Then next, the second point which we are telling is cells of malignant tumors are apoptotic. We told already what is apoptosis. Apoptosis means programmed cell death. Okay, but this benign tumors, they have a programmed cell death, but malignant tumors, they don't have a programmed cell death. So that second option, cells of malignant tumors are apoptotic, that is wrong. Then the first point, cells of benign tumors are typically aplastic. Aplastic means defective development. Defective development happens in malignant tumors. It doesn't happen with a benign tumor. So here the answer is cells of malignant tumors lack contact inhibition. We know that contact inhibition happens in benign or the normal cells. That means when one cell come in contact with another cell, its growth stops. But in malignant tumors, there is nothing like that. There will not be a stoppage. So the cells of malignant tumors lack contact inhibition is different from the benign. Next one, the nurse understands an important laboratory assessment parameter of a patient with cancer that has metastasized to bone is which of the following? White blood cell count, calcium level, glucose level, sodium and potassium level. So here bone demineralization, it has gone to metastasize to bone. So bone demineralization or resorption with the release of calcium into the systematic circulation occurs. So here the option is the increase in calcium level can be seen as a laboratory finding if the cancer is metastasized to bone. What is the most specific method of diagnosing a malignancy? Serum laboratory test, MRI, CT scan, biopsy. So the answer is biopsy. So through biopsy, what happens is we can diagnose the disease based on the evaluation of the cell pathology from the cells obtained. So cytopathologic diagnosis happens with this biopsy, and that is a confirmation of malignant tissue. Next question. The nurse understands that the patient receiving chemotherapy prior to definitive surgical excision is receiving which type of treatment? Is it a secondary treatment, adjuvant therapy, neoadjuvant therapy, primary treatment? So here you need to understand two things. What is a neoadjuvant therapy and an adjuvant therapy? Neoadjuvant therapy means a therapy that is used to shrink the tumor prior to definitive removal or destruction. So here prior to the surgical excision only we are giving chemotherapy. So that therapy is to shrink the tumor, that is known as neoadjuvant therapy. So the answer here is neoadjuvant therapy. You need to know what is adjuvant therapy. Adjuvant therapy is defined as a treatment that is used in a patient who is currently disease free or is in a remission stage but is at high risk for relapse later on because of the remaining microscopic malignant cells that will regrow at a later stage. So later on what treatment we are giving, that is known as adjuvant therapy. So here the chemotherapy which we are giving is to shrink the tumor size, and it is done prior to the surgery, and that is neoadjuvant therapy. Which statement by the patient indicates teaching about chemotherapy was effective? I know everyone loses their hair with chemo. I know it is important that I monitor my temperature. I know I should eat whatever I want so I don't lose weight while on chemo. I understand I skip a chemo treatment if I don't feel well. So here, monitoring temperature is very important due to the risk of infection, because the WBC count is going to be reduced with chemotherapy. And the other options, if you see, the loss of hair or weight loss is not so common with everyone, and also the patient should not skip the treatment. So the answer here is the patient has to monitor the temperature. What is a primary prevention strategy to reduce the cancer risk profile for a 21-year-old female? So here that age is very important. Is it a mammography, vaccination, genetic screening, or calcium supplementation? Primary prevention strategy. So some viruses are considered to be carcinogenic, such as human papilloma virus and hepatitis C viruses. They are carcinogen. So immunization to prevent these viral infection is considered protective and will reduce the cancer risk profile. So vaccination is the thing that is given for a 21-year-old female as a primary prevention. Mammography is something for a secondary prevention strategy to early identify. And genetic screening, if you see, it will reveal non-modifiable risk factors that may or may not be prevented by this primary prevention. And there is no evidence that calcium supplementation is needed to reduce the risk of cancer. Next, a patient presents to his provider with a nagging hoarse cough with complaints of hemoptysis. The provider will probably initially order which of the following tests to assess for cancer. Is it a PET scan, MRI, chest X-ray, or biopsy? Here, the patient has complaints of nagging hoarse cough with hemoptysis. So chest X-ray will allow the provider to visualize the chest structures and assess for the presence of any masses. PET scan, it's an imaging study that is used for visualization of a tumor to evaluate the metabolic activity and metastasis. This is not indicated at this particular time. And MRI is another imaging study that is most appropriately for brain and joint tissue. And biopsy is indicated when an unexpected mass is identified. Here we are not identifying any mass, or we are not seeing anything on the brain or joint tissue. Here the patient is having problem with the chest. So chest X-ray is fine. The nurse will be concerned about cancer if an otherwise healthy 47-year-old female patient makes which statement during an assessment? Lately, my stool has changed shape. It's thin and ribbon-like. I am having difficulty sleeping and I am losing weight. I have a fever and I am coughing up thick sputum. I have been experiencing nausea and vomiting in the morning. So here you need to understand about the clinical manifestations which are the presenting symptoms of cancer. Change in stool shape to thin and ribbon-like may indicate obstruction from a tumor. Difficulty sleeping, it can be because of her menopausal things. Fever and thick sputum, it may be because of cold or flu. Nausea and vomiting may be because of any viral or bacterial infection. Here, the best suited answer is, my stool have changed shape. It is thin and ribbon-like. Let's see the next slide to understand little more about this. So warning signs of cancer, you can use acronym caution. Change in bowel or bladder habits. There is a sore that does not heal. There is unusual bleeding or discharge, thickening or lump in the breast or any other part of the body, indigestion or difficulty swallowing, obvious change in a wart or a mole, nagging cough or hoarseness. Here in the previous statement, the patient had changes in the bowel or bladder habits. So that is a warning sign of a cancer. You need to know this mnemonics. With that, you will be able to answer that question. The mnemonic is caution. This is a case scenario. Mrs. Mary has stage 3 breast cancer. What does this mean? So the tumor has spread to lymph nodes and other organs. The tumor is small and localized and has not invaded other organs. The tumor is large, locally advanced and possibly in local lymph nodes. The tumor is large and has spread to the lymph and hematological system but not to other solid organs. So here the answer is the tumor is large, locally advanced and possibly in local lymph nodes, that is stage 3. To answer this type of question, you need to know the staging of cancer. Stage 1, a small tumor without obvious spread outside the organ. So that is termed stage 1. Then stage 2, the invasion of deeper tissues or involvement of local lymph node, that is stage 2. Then stage 3 is large or locally invasive tumors. Then stage 4 is cancers that have metastasized to other organs, and all hematological malignancies are termed as stage 4 because at the time of diagnosis itself, because the disease is not well contained or localized, the classical or the hallmark clinical feature is present, that is hematological spread is there, so that is stage 4. So here the patient had a large locally invasive tumor, so she is in stage 3. Mrs. Mary's oral hormonal therapy is considered what type of treatment? Is it a chemotherapy, adjuvant therapy, neoadjuvant therapy, primary treatment? Already we have seen what is an adjuvant and neoadjuvant therapy. So here she is taking oral hormonal therapy. Adjuvant therapy is a treatment used in a patient who is currently disease free or they are in remission stage but they are at high risk for relapse. So to prevent that, we will be supplementing hormonal therapy, so that is a adjuvant therapy. The nurse is preparing to provide patient education to Mrs. Mary, who is about to start her first cycle of chemotherapy. In addition to self-management strategies and supplemental medications for persistent acute effects, the nurse will educate her on the importance of immediately calling her provider if she experiences what symptoms. Is it a hair loss, dry skin, fever, nausea? Fever may be secondary to an infection. Hair loss, dry skin, nausea, they are expected side effects of a chemotherapy and they don't require an urgent intervention. But fever, if it is there because of reduced WBC, it needs immediate attention. The nurse is about to start Mrs. Mary on her first dose of taxane chemotherapy. This will be Mary's first infusion of paclitaxel, a plant alkaloid which is a vesicant and can cause hypersensitivity reaction. What should be done as a part of nurse's preparation for drug infusion? Select all that apply. Here from the scenario itself it is given she is going to get a plant alkaloid and there are two problems with this alkaloid, that is one is it is a vesicant and second one it can cause hypersensitivity reaction. Let's see the options. Pre-medicate Mrs. Mary with vitamin K. Make sure emergency equipment, oxygen medication is working and easily accessible. Review Mrs. Mary's medication record to make sure she has had an ECG completed within the last 24 hours. Check Mary's IV access by flushing the line and checking for good blood return. Check Mary's blood glucose level. So this is a planned alkaloid that can cause hypersensitivity. So we have to keep all the emergency equipment ready. The second one we have told in this scenario, it's a vesicant. So frequently you have to assess the quality of the IV access by flushing the line and checking blood return. So these are the two important things as a nurse has to see. And this vesicant is not associated with blood clotting, so no need of vitamin K. Glucose level monitoring is not required and cardiac arrhythmia chances are also not seen. Mrs. Mary is now presenting status post-mastectomy for external beam radiation therapy to her left breast and left chest wall. The nurse caring for Mrs. Mary pays particular attention to which of the following systems during the head-to-toe assessment. Select all that apply. Is it the renal system, integumentary system, musculoskeletal system, cardiac system, and respiratory system? So radiation therapy, you know that it can be delivered externally via an external beam therapy or internally via placement in a cavity or a reservoir in the body, which is known as brachytherapy, or systematically via injection of a radioactive substance. You know this. So here the patient is getting an external beam radiation therapy. It put the patient at risk for skin irritation and impaired skin integrity. So integumentary system you need to check. Also the radiation is on the left chest wall. So it is near to the heart and the lungs. So cardiac system and respiratory system also need to be assessed. Hope you understood this video. Thank you for watching. Please do subscribe.